Surgical attire has evolved over time. Before the 19th century, surgery was performed in street clothes with rolled up sleeves. By the mid 19th century, surgeons adapted the black frock coat. This coat was often covered with blood and pus stains from previous patients. This dirty coat actually symbolized the badge of honor for surgeons. Caps, gowns, gloves, and masks were not seen in photographs until the 1900s. The lack of proper surgical attire in the 1800s directly correlated to higher death rates and infection. As surgeries and research continued to evolve, the Association of Perioperative Registered Nurse published surgical attire guidelines in 2014. These guidelines state that all personnel entering the operating room should have proper covering. Wearing proper covering today is used to prevent and decrease the spread of infections. As time has evolved, we can acknowledge that the clean attire fosters a safer environment than the street clothes and the dirty jackets that were worn back in the 1800s. The purpose of this presentation is to discuss how surgical attire can decrease surgical site infections. This presentation discusses the evolution of surgical attire and the most recent research on the correlation between surgical attire and patient infection. This presentation will also discuss and examine the current guidelines and protocols for surgical attire that healthcare professionals practice to prevent patient infections and diseases. It will then conclude with recommendations for current and future surgical attire practice.
So here we're going to talk about OR gown contamination when worn outside of the operating room. So a research article that we've reviewed for our project did review 6 different randomized controlled trials. The authors concluded that while the OR gowns when worn outside of the operating room did contain some bacterial organisms such as VRE, C. diff, and staph, these did not translate to an increase in surgical site infections and did not pose a significant risk to patient safety. The limitations of the study were that they were limited in size, so a meta-analysis was not able to be conducted, and the authors did cite that there was some bias in their observational study as well. The conclusion from this article, though, was really that more research is needed. It seems as though we follow these practices for using sterile OR gowns more so out of habit and for historical reference, but the research truly isn't really showing us that, that it's necessarily going to decrease any risk for surgical site infection for these patients. So on this slide, we're going to be looking at surgical headwear covering. So the authors aim to see if the surgical bouffant or the skull cap was more beneficial in reducing bacterial shedding. So as we're aware, all OR staff, it is a requirement that our hair is completely covered, and that is to reduce the risk of bacterial shedding and contaminating the sterile field, and potentially leading to an increase in surgical site infections. So what the authors did find was that the skull cap covering, if laundered appropriately after each shift, there was a reduction in bacterial shedding when compared to the surgical bouffant. However, neither one, regardless of the amount of bacterial shedding that was found, was shown to increase surgical site infections. So what the authors recommend really is that hospital policy really be aimed at what we know is to really just make sure that your surgical cap is tight fitting, and that it's completely covering your hair, that all of your hair is tucked underneath that, and best you can around the ears. So again, more research is needed to actually cite and see if, these skull caps and these head coverings really, if we didn't wear them, if they would actually lead to an increase in surgical site infections.
A retrospective study evaluated approximately 34,000 inpatient surgical encounters over 22 months. This study examined surgical infection risk within 3 study groups. The study evaluated the number of infections, first with no surgical jackets and bouffants over 8 months. It next evaluated the number of infections with mandated surgical jackets for approximately 6 months. Lastly, the third group examined the number of infections with both surgical jackets and bouffants for 8 months. The results show that there is no significant difference between study groups regarding surgical risk for surgical infection, post-operative mortality, sepsis, and wound dehiscence. The combination of surgical jackets and bouffants made no difference in decreasing surgical infection risk.
So on this slide, we're going to be looking at the benefit of wearing a surgical mask during a surgical procedure. So as we're aware, part of our surgical attire is wearing a mask at all times while in the operating room, whether you're anesthesia staff or one of the scrub nurses or obviously the surgeon. So the authors aim to look at comparing surgical site infections with in surgeries that had operating staffs that were masked or unmasked. And what they found actually was pretty surprising, at least to me, was that it really didn't show a huge benefit. So they were looking at all OR staff. So that was everybody from those directly on the surgical field, so your surgeons, your scrub nurses, anybody who was scrubbing in for surgery, and then as well as maybe your circulating nurse or your anesthesia staff, obviously. And it really didn't show a huge difference in surgical site infections. So some limitations though to this were that a lot of these studies were outdated. They were looked at from like the mid-1900s. So definitely more research is needed to identify the benefit of masking. And it's important to note that masking does remain a standard for aseptic practice and source control. This is mainly to limit droplet spread during talking, coughing, anything of the like that may occur on the surgical field. One other thing I wanted to note was that the authors did find that although it was a small difference, there was a slight benefit to masking, and this was mainly found, to no surprise, when the scrub personnel were masked versus not masked. So in other words, the authors found that there was a decrease in infection when the scrub personnel were masked, not necessarily those like anesthesia personnel. So again, not necessarily strong, robust evidence that everybody in the OR needs to be masked, but there was a slight benefit to those who were actually in the sterile field.
A study was conducted to analyze articles regarding the correlation between shoe soles, floors, shoe coverings, and infection risks in operating rooms. 18 articles were evaluated in this study. It was found that hospital floors are contaminated with pathogens such as MRSA, VRE, C. diff, and Candida species. All of these pathogens are responsible for healthcare-associated infections. Shoe soles serve as a reservoir in the chain of infection. Studies show that there is no significant benefit in the use of shoe coverings for decreasing surgical site infections. Research shows that manual cleaning with mops and UVC radiation is adequate in decreasing infections. In addition, disinfecting shoe soles can also be adequate in decreasing the risk of infection. According to the AORN guidelines, masks should be pressed tightly against the face to prevent microorganism droplets from spreading. Microorganisms could be spread through talking, sneezing, and coughing. When masks are used correctly, it is beneficial in preventing surgical infections. Guidelines state masks should be changed if soiled and should be changed between each case. Masks should not be reused. Although many healthcare personnel wear masks around their necks, guidelines state masks should never hang from neck or be placed in pockets. Masks should be worn properly according to the manufacturer. Current OR guidelines, gowns and scrubs. Gowns should be worn in sterile fields to prevent the risk of infection. The gowns should be protective and only used once. OR scrubs must be worn in restricted areas. Scrubs that are contaminated with blood or body fluids should be changed as soon as possible. OR scrubs should be properly and frequently washed by the hospital. Current guidelines for surgical caps. According to the AORN guidelines, surgical caps must be worn in semi-restricted and restricted areas. The purpose of these caps are to cover the scalp and hair fully. Hair, beards, and scalps can contain microorganisms that can shed into the OR environment. Men should also properly cover their facial hair, such as beards. Beards should be covered properly, especially when assembling sterile work spaces. Proper head covering sizes will decrease the shed of microorganisms. Guidelines for the future. Healthcare personnel also wear lanyards and identification badges. These are also considered a part of the healthcare attire and should be discussed. Nylon and polyester material can hold many pathogens. Research shows that there is a direct link between lanyards and bacteria. ID badges are also frequently used and attached to personnel. Frequent use of ID badges throughout the hospital can increase bacteria and pathogens. Wearing both can increase risks for contamination in restricted areas. Stricter protocols for disinfection should be instituted to decrease the risk of infection. Cell phones are also used throughout the day and kept in the pockets in the OR. Cell phones can act as a breeding ground for microorganisms. This is another increased risk for infection if used in the OR. Proper protocols should be in place for frequent and proper cell phone disinfection. What has been done to improve this safety concern? Guidelines from the AORN and the CDC have been created to improve the safety concern regarding surgical site infections. These guidelines were created to enhance patient safety in the OR. Additionally, guidelines were made to protect not only patients, but also healthcare personnel. Hospitals have implemented educational training to ensure team members understand the importance of correct surgical attire. By receiving proper training, Healthcare personnel know how to properly wear surgical attire to prevent infections and protect themselves and their patients. Research on the effectiveness of surgical attire is constantly being done. Research ensures that healthcare workers are implementing the most current evidence-based practice. Continuous monitoring and real-time feedback provides the surgical team with information on how effective their practices are. A comprehensive approach with guidelines, education, research, continuous monitoring, and real-time feedback is imperative for successful surgical attire implementation.
Surgical dress codes are not being implemented without challenges. Ensuring strict compliance by all operating room staff is one of the primary obstacles. People may feel discomfort or perceive the inconvenience of wearing or more protective clothing or adhering to strict standards. Another notable challenge is the expense of obtaining and sustaining the surgical jackets, bouffants, and other necessary clothing. Hospitals have been spending an increasingly amount each year on surgical jackets despite research findings indicating that they may not play a significant role in the reduction of SSIs. The economic cost of adhering to these practices, particularly in under-resourced healthcare systems, may be discouraging. Healthcare institutions may face challenges in persuading new staff due to cultural resistance, especially when there's an inadequate body of evidence demonstrating the benefits of particular attire selections in enhancing patient outcomes. Despite these difficulties, continuous research and cost-effectiveness assessments will be required to improve patient safety and mitigate implementation barriers. The following are some of the key stakeholders involved in the implementation and enforcement of surgical attire legislation aimed at reducing SSIs. These are the surgical staff, infection control staff, and hospital administration. The surgeons, anesthesiologists, and nurses are the big users of the prescribed attire, whose job is to adhere to the guidelines in all surgical procedures. Infection control teams monitor and apply the same protocols to ensure a sterile environment is maintained. The role of hospital administration is crucial as it provides the necessary procedure that need to be followed. Regulatory bodies such as the CDC, AORN have general policies that to some extent guide hospital policy. All these stakeholders work towards ensuring the realization of a single version to increase patient safety, decrease infection cases, and ensure that personnel handling elements of the surgical arena are appropriately dressed. To ensure patient safety in the operating room, unity among these groups is crucial to success. The use of surgical attire policies in healthcare settings has various problems. Ensuring that all operating room personnel consistently adhere to work rules is one of the main challenges. Observing dress codes may not be comfortable. Certain employees may not be willing to wear extra protective clothing, such as long-sleeve jackets or large head covers, due to perceived level of discomfort or inconvenience. Additionally, the immediate relationship between appropriate dressing and the prevention of surgical site infections is not universally understood, which may diminish the perceived importance of such actions. These guidelines must be implemented with training and education so that every staff member understands how important it is to stay in line with these guidelines. Other logistical issues can pose obstacles as well, such as the frequent washing of garments and maintaining sufficient stock on hand to ensure the supply is never exhausted. Such obstacles may complicate the introduction of effective patient safety practices, so both cultural and logistical aspects of following the surgical attire protocol need to be addressed. Cultural resistance is one of the challenges in adopting cultural surgical attire guidelines. The resistance is why many health facilities are struggling to acquire more protective gear, mainly because protective clothing is considered inconvenient or unnecessary. Individual workers may think they are being misled by using surgical jackets or bouffant head coverings. Hospitals that have successfully implemented these guidelines claim that they must create a culture of safety in which team members understand their role in the patient's welfare. Leadership is significant in ensuring adherence to established expectations that exemplify desirable behavior. Among the lessons gained, it is observed that the introduction of patient safety practices will most likely happen as a collaborative initiative. A significant problem to the adoption and full implementation of surgical attire guidelines is the issue of financial constraints and limited resources. Such surgical jackets, bouffant head coverings, and other mandated attire are costly, notably when one anticipates that a whole hospital will need to stock them in such large quantities. Such costs can burden hospital budgets, especially in environments with limited resources. Some smaller healthcare organizations can have difficulties with buying sufficient supplies of sterile and non-sterile attire. With hospitals still facing financial constraints, they may be hesitant to spend money on expensive garments which may not directly lead to a reduction in surgical site infections. Moreover, there is added expense of cleaning and keeping proper clothes, a daily expenditure that imposes another burden. To overcome such financial obstacles on part of the hospital, it is essential to demonstrate the cost effectiveness of these practices and the value of this program in terms of the returns realized by end users, which may not be immediately apparent. Current approach. Surgical clothing can eliminate the risk of surgical site infections and provide a high level of safety to patients, but its effectiveness remains a controversial topic. Recommendations by the AORN to support the wearing of appropriate clothing in order to reduce microbial contamination have reported mixed results. These barriers still have not deterred the further enforcement of these guidelines in order to conserve a sterile environment and to prevent potential
So to summarize,
infections.
the surgical attire has changed significantly over the past century. So we start with that black frock gown, the one that was covered in blood and pus and was really seen as a badge of honor for surgeons, to, now we are in brand new gowns for every single case. We're covering our hair completely. We're wearing masks. Sometimes we're wearing eye protection, which, is more so to protect the surgical staff than the patient, but nonetheless, the point is that we are being covered from head to toe these days. So our surgical attire has changed significantly. However, with all of that, there still is not a huge amount of evidence that necessarily supports it. So going forward, there's definitely going to need to be a lot more research to be conducted to kind of support everything that we do. Patient safety should always be at the forefront. We need to do everything possible to prevent any type of surgical infection to these patients. So if that means that we take these precautions that may not be grounded in scientific evidence, so be it. But I do think that, we should continue to research this because maybe there are certain things that we don't need to do and we can cut down on costs, which, can then go ahead and hopefully save money for the patient, or maybe we can eliminate some of our environmental burden. So just some things to think about going forward. Currently, our recommendations are to be wearing sterile scrubs, scrub caps, and masking at all times in the OR. But I do think that it is worthwhile to continue researching to see if there is something that we can do that, might change things up, might make surgical staff a little bit more comfortable, reduce hospital waste. These are all things that are important going forward, and it's something that we all really should care about. So again, just kind of going a little bit deeper into the surgical attire. So with masking, we want to ensure that we're changing our masks whenever they're soiled or they're moist. Masks should not be worn around the neck. They should be changed from case to case. In regard to shoe coverings, they can be worn. That's probably going to be more so something to protect your shoes and the surgical attire, the surgical staff, that is. But there really is not a significant change in patient infection risk. So continuing in our summary, we have lanyards and cell phones. So both of these guys are frequently used by all hospital staff, right? So most hospital staff use a lanyard, but at the very least, we all have an ID badge. So as we're going from patient to patient, these ID badges harbor bacteria. So we need to create better, stricter protocols to disinfect these to prevent the spread of infectious organisms from patient to patient. Additionally, cell phones are being used more and more by hospital staff, whether it's just for communication from staff to staff. Perhaps some facilities are going to be using these cell phones to scan medications, scan ID badges on patients, or any other type of interoperability with the electronic medical record. So again, we need to make sure that we know how to clean these cell phones so that we don't unintentionally spread some type of infectious disease from our patients, especially when they're super vulnerable after surgery. So these are some things to keep in mind, and more research is needed to help guide these hospital protocols. So stakeholders involved are obviously going to be the OR staff, right? So that's your surgical team, everyone down from the surgeon to anesthesia and everybody in between. So these groups are going to be led by the Association of Perioperative Registered Nurses, or the AORN, as well as the Centers for Disease Control, or the CDC. So the CDC is able to track the infectious data, and then the AORN is going to be able to set these specific guidelines for the hospital staff to follow. The biggest hurdle that we're going to find is probably going to be the culture of the OR staff. If they're used to doing something, it's going to be very difficult to change that. So that is one thing that we have to get creative about when it comes to changing guidelines. In regards to legal implications of OR attire, we weren't really able to find too much in the literature. We looked towards the Joint Commission to see what they look at when they're surveying hospitals, and what we were able to find is that the Joint Commission doesn't actually have a universal policy that they survey off of. They more so look towards any state laws, Medicare and Medicaid, any protocols that they might put out, ensure that OR staff are using OR equipment appropriately, so gowns aren't expired, masks aren't expired, and they're being used in the correct manner. So they tend to look more so to make sure that staff are using those things appropriately, and if not, then there could be legal implications. But other than that, there's not really a set standard across the board. It's more so going to be a state by state and hospital or facility, the facility basis. So some more research is needed for jackets, surgical caps, and if they have a significant decrease in surgical site infections. A financial analysis on the cost breakdown of sterile OR attire versus the benefit to the patient would also be beneficial in help guiding hospital policies. And finally, we definitely need to create more strict cell phone disinfection policies, as well as ways to keep our ID badges clean, and ways to prevent infection spread from patient to patient. So more research in this regard to help guide these policies. So diving in a little bit more about the OR attire, so if there's not really a benefit to OR scrubs, hospitals may be able to cut cost and move that money into areas that may be better suited. Additionally, environmental impact, as already stated, especially from disposable scrubs that may be used on a daily basis, should be looked into. More research has shown that the various surgical policies do not necessarily decrease surgical infection risk. This is not to say that every precaution to ensure patient safety shouldn't be taken, but it does beg the question, are these policies really beneficial, and are they necessary? So this has already been kind of talked about throughout this presentation, but as the usage of cell phones continues to increase in the hospitals, we know that these devices are a breeding ground for bacteria, as research has shown. So actually the AORN has updated their guidelines to promote better cleaning of cell phone use by OR staff. So that's everybody from surgeons, anesthesia, nurses, everybody in the OR. So our team's recommendation for this would be to provide ample hand sanitizing stations in the OR, which allow for frequent hand washing after touching personal devices. Additionally, more research to decide on how often cell phones should be wiped per shift can help drive some evidence-based practice to help prevent the spread of disease to patients. So finally, some barriers to implementation. So it's going to be cost, staff implementation, and buy-in. So cost, if we are talking about, let's say, for cell phone cleanliness, right? So if we want to have staff wipe phones down or possibly use those UV sanitizers, that's a cost of the hospital system. So those are all things that we need to look into. And again, we're going to need research to drive it. Is this actually going to prevent infectious spread? If so, then we can create a case for our financial departments to invest in this technology. Additionally, implementing into staff, we talked about this before, OR culture, any type of culture in healthcare or really anywhere, once you're stuck in your way doing one thing, it's going to be pretty difficult to change. So right now, taking your phone out is like second nature. Even in the OR, yes, we're monitoring our patients always, all the time, but cell phone usage for healthcare workers is going up exponentially. Now we can access the medical record on our phone as opposed to going into onto the computer. Now sometimes we can scan our patient's ID wristband and scan medications, all of that, all from our phone. Take pictures for the patient chart, all on our phone. So we're constantly using our phone, and our phones are interacting with patients. And our patients sometimes are carrying infectious diseases that might be spread from patient to patient or even worker to worker. So creating good policies to keep these devices clean and therefore staff and patients safe and healthy is paramount. So getting that buy-in, it will be difficult, but it is something that we need, I think, to create the case and make sure, our staff understand that, good cell phone and ID badge hygiene, it's really an extension of hand hygiene, and we know that that's one of the best ways to prevent patients' infection spread. So I think putting it into that light will be really beneficial for staff buy-in, but it's something that we're definitely going to have to work on going forward. So more research and getting creative with ways for our staff to actually implement this into their day-to-day culture is going to be our two biggest hurdles.